Hello, everyone. Welcome to this month's edition of the Rareminds podcast. I'm Kym Winter. I'm a psychotherapist and Chief Clinical Officer at Rareminds, and I'm really delighted to have not one but two guests again today. I have the lovely Sian Moorcroft, who is a researcher by background, and I also have Lauren Roberts, who is Rareminds CEO. So, we're going to be talking today about a really interesting new research method that has come onto Rareminds' radar recently called social listening. And we're going to be talking about the potential of that as a new research method for the rare disease community, but also some of the perhaps things to take into consideration, the hazards, or how we feel about it as a research method too. So, I'm going to come first to Lauren. Just to say that one of the things that led us into this method and being interested in it in Rareminds was how we conduct research into levels of suicidality or suicidal thinking across the rare disease community, which we know is a really sensitive area to be talking about generally. So just wanted to make you all aware if you are listening and that's a subject that you might not want to tune into at this particular point, please do feel that you can give it some space at this time. So Lauren, I'm going to come to you and tell us a little bit about how we got interested in social listening through Rareminds.
Thanks, Kym. So as you said, we'd had some discussions, I think, for quite a long time around whether this was a research methodology that could be used to explore the kind of mental health impact of rare conditions in a way that was less invasive and potentially less triggering for people, because we weren't asking them to relive their experiences. We were just kind of going in to look at what they were saying. So I guess just before I sort of talk about what we did, just to say for anyone that's not aware, social listening is basically looking at what people are posting on the internet and then using that to kind of develop themes or just to explore what's happening out there. So we were very lucky that we worked with a company called Partners for Access, who have a rare pulse machine, is probably the wrong term, but they have a very clever AI learning machine which can scan the internet and look for mentions of things. And when I first got in contact with them, they were saying that when they this is part of their business model, they use it a lot with industry when they're looking at research around new treatments or new drug therapies. And they were saying that mental health was coming up a lot, sort of as an incidental finding in work they were doing anyway. So they were really keen to work with us and help us explore, is this something that could be used in this area? And so we did a sort of scoping exercise just really to see what would come up and how that would be. There were 5 conditions that were chosen, which was MPS, MSA, PKU, MSA, and Cushing's. And we only used publicly available information, so there were no private groups or closed forums that were looked at. Interestingly, the main source that came out in the end was Reddit, but there were also some posts from X, also things from YouTube. And I think they started off with over sort of 100 million sources, and then they filter it down, and we ended up with 54,000 online posts, across those conditions. And then they dug into them to look at what was being talked about, what were the posts mentioning. There were overall, there was a kind of 80% net negative sentiment, which actually, I think we're not really here to dig into the methodology too much, but that in itself is quite interesting in that we know that people generally go on the internet to moan about things. So I think you'd probably take that with a pinch of salt. But what was really interesting was the themes that came out. So overall, there were kind of 5 themes around the emotional, psychological impact of having a rare condition, the physical impact, uncertainty, the social and relational aspect, and the diagnostic aspect and the honesty, which I think all feel quite familiar to us. There's nothing there that feels really groundbreaking. What was interesting was it was the emotional and the psychological impact theme that by far came up the most. That's what people were talking about the most, not getting a diagnosis, not getting access to treatments, but more just how it affected them in their lives. And within that, there were other themes of grief, anxiety, isolation, caregiver exhaustion, and a small number of suicide ideation. And I think it was really insightful into how kind of raw and unfiltered this was and how much potential there is to use this in this area. but almost because it was so raw and unfiltered, it made us go, oh, this really feels like we're getting an insight into what people are saying. And really, then I guess, we had those internal discussions of what do we do next with this? There's so much potential here, I think, to use as a way for exploring the mental health impact of rare conditions or rare conditions in general. But it felt important that we had some discussions with people, because I think that it's quite a new methodology. Most people aren't aware of it. So we started a bit of a discussion last week at Rare Summit in Cambridge. I did a workshop in it, which I'll talk a bit more later about the themes that came out of that. But as part of that discussion, we reached out to various other organisations, which is how I then met Sian, who also has been using this on a smaller scale for her dissertation. So we just thought it would be really interesting as a follow-up from the Rare Summit workshop to kind of do this podcast really and continue the conversation.
And I think what's really interesting about this methodology is that, like, we all know that the internet is one of the first places that people turn to now for support for both physical and mental health. But to know the ways in which they are using it and how that could be responded to appropriately, or just what is out there, and particularly those who are not engaged with either our services or perhaps patient organisations that I know we're very mindful of, but also other patient organisations are mindful of. Who are we not reaching and why, and where are they turning to for support? And I think that's where this research is really helpful too.
Yeah, and I think that definitely came out of the workshop discussions, that this is a way to potentially hear from those voices that aren't engaged in the normal ways that would be responding to questionnaires or to surveys, that we can, there's some limitations of being able to say definitely, but I know, Sian, when we were talking, you think potentially your findings suggest that these were people that weren't linked into other kind of support networks. And I think that one of the things that came out of the workshop as well was around how it's not going to be the whole picture, but it can kind of sense check what we're hearing from other ways. So maybe it's part of the puzzle, and that potentially, often the most engaged people, especially from an industry perspective, some of the people in the workshop were saying it's often the contact they have is with the most engaged patient advocates. And that is absolutely vital in pushing things forward and helping to create awareness and drive. But it means that they are the most informed, and sometimes it's useful to be able to sense check that. And the same way with clinicians, they said often clinicians will tell them what is most important to patients, but actually the social listening is suggesting it's not that at all, it's something quite different.
Because we all speak from our own familiar place and perspective, don't we? So having that broader reach is really interesting. Sian, can I come to you now? And maybe this is a good opportunity before we talk a little bit more about, we'll just share some of the conversations we've had internally about, what does this new methodology mean? How do we use it? Some of our anxieties and excitements in that regard. Sian, tell us a little bit about your research and your background.
Yeah, so I am a graduate. I just graduated with a psychology degree, and I decided to do my dissertation on the online support that people with spinal muscular atrophy were looking for. And I decided to look on forums like Reddit to sort of scan all the public available data on a bit of a smaller scale. And I ended up coming up with 3 themes. So the first one was more of a medical theme. So I found that a lot of people felt sort of unheard, pushed aside, which often caused high levels of anxiety, distress, and you could quite clearly see that from their posts they were very upset. They tended to find that healthcare professionals either didn't treat them equally to other people with progressive prognoses, or they just didn't listen to their wants and needs in general, which left them feeling really frustrated. And they also felt that a lot of healthcare professionals didn't have the knowledge or understanding of their condition to be able to fully support them. So they ended up turning to Reddit to find that information. Then the second theme was treatments. So there was a lot of misunderstandings around the expectations of what should happen once they've received the treatment. There was a lot of concerns around side effects and sort of how to manage that and if that's normal, because they didn't feel they could go to their doctors to ask them questions. And then the final thing that I found was relationships. So there was a big there was a big struggle with navigating things like dating, like finding a partner who's sort of able to look past the disability, and sort of navigating that scenario. And then also a lot of people with SMA rely heavily on their parents or carers to provide care and support for them. So there was a lot of sort of a psychological burden on people, either their family members or themselves with SMA, that were putting posts up. And yeah, and I ended up kind of, it really showed how, you know, I thought from a personal sort of background that the knowledge was out there and the information was out there, but after looking at the results, it seems that there's still quite a way to go.
That's a really key finding from your research, isn't it? That there may be all sorts of assumptions or about what information and support is out there on the part of healthcare professionals or patient organisations. But some people are not hearing that, or they are not feeling able to access it for a really presumably wide variety of reasons. And I think that's a hugely important outcome of your research with your particular community, the SMA community. But I think also we might assume that there's at least some overlap in other communities in the rare disease community more widely. Lauren, what are your thoughts about that?
I think it's really interesting how there's a lot of overlap in the themes that you found. And one of the key things that came out generally in the other posts that through the work we did with Partners for Access was that people are feeling unsupported and they're just overwhelmed by uncertainty. And I think because the rare community is such a tight community, and, you know, there are so many super well-informed advocates and amazing groups, that we forget that's not where everybody starts. And that actually, you know, in those early days when you're looking for information or you're wondering where to go, actually you probably are going to go to the usual sources you go to, which, you know, I mean, I go to Reddit every time I need to know how to wire a plug or something, but it's one of those platforms that people go to in those early stages. And I think it's interesting to think about it in that terms as well, as does this offer insight into people at different stages in their journey. I mean, before I was at Rareminds, I worked for a long time with SWAN UK, which is Syndromes Without a Name. And I remember in the early days of setting that up, all I did was go on the internet and go to other forums to look for people that were talking about it. And then eventually we built a critical mass and kind of had our own group. And then it was all about trying to drive people there. But I think it's really interesting to be able, I guess, to get a reminder that not everybody know, because the information is on the internet, it doesn't mean people are finding it. And one of the things that came out of the workshop when we were talking about how should this be used was around sort of making sure it has tangible benefits. So it's obvious why we're doing this. And I think that to me was really interesting about your work, Sian, because you didn't just hand in your dissertation and go, that's it, did you? You kind of were really proactive and thinking, okay, how can I do something with these things?
Yeah, I think it was sort of, I could either chuck it under my bed and never think about it again, or I found hopefully some findings that might help influence other research and actually help people in the future. And so I reached out to the SMA UK, who put me into contact with Rareminds, but they also were quite shocked about the limited knowledge people had. I think they thought that they were reaching more people than they originally thought. But I mean, I couldn't quite tell the demographics of where the posts were coming from, but I presumed it was more non-Westernized places. And so obviously it isn't kind of just a UK thing, it's kind of like a worldwide thing that, yes.
I think there's something really interesting for me, if I kind of put my psychotherapist hat on for a minute, which was sparked a bit by what you were talking about how freely people use these forums for a range of issues, Sian, but also you talking about you go to Reddit to find out how to wire a plug, Lauren, and how shame can act as an inhibitor when we are wanting to find something out, or we feel we don't know something, we feel stupid. We may not want to, often in Rareminds, we encourage people to ask their healthcare professionals any questions, ask the stupid questions, ask your patient organisations, ask the stupid questions. But sometimes we can meet a level of expertise that makes us feel a bit embarrassed or a bit stupid, or we just can't take something in because we don't understand it. But there's something about being able to go to something like Reddit and just ask a stupid question, or just say, I'm not coping with this very well. Is anyone else struggling too? Which is much freer and perhaps feels less shaming. And I think that's a really important thing to notice. There's also the idea of something called online disinhibition. We were talking a bit about this earlier, which is the idea that people express themselves much more freely online because you don't have to face the potential difficulty of how someone might react to you. Now, that has pros and cons. Some people discharge stuff in a kind of rather incontinent way, like, I really hate this. And of course, you don't see how it might hurt the other. And so you don't draw back in the way that you might in a face-to-face encounter. But the other side of that, I think, is that it allows you to speak more freely when you are struggling. This is really difficult. I'm really struggling with this. And you may get others go, yeah, no, that I really get that, in a way that they sort of don't have to respond then in a way that you may feel your autonomy is taken away, or you feel stupid, or you feel you should know something. Does that make sense to you in terms of, I think we all use social media a little bit like that, we just put it out there. But it's interesting when we think about it in terms of social listening. And I think something that came up in the workshops a bit, Lauren, was around are we just sort of eavesdropping? Are we just sort of snooping? Where's the kind of privacy to be able to use this freely or not? And what our kind of responsibilities are in that regard, and how we use this method benignly and for good, if you like. And it raises really interesting questions.
Yeah, I think that's the kind of the crux of the question, and it is. I think, I mean, the workshop, I think, probably needed to be 4 times the length it was because
Probably.
about. But I think it did keep coming back to this idea of a sort of tangible benefit, and also about using it responsibly, and about, so if you would, there's a difference between, I think, sort of internal and external use of this as well. So if you're using it sort of as an internal tool to inform your strategy or like a dissertation, that's slightly different, I think, to the idea of using it for research, where you're then going to publish it and get it out as widely as you can, because then, the power of this research is the raw, unfiltered spontaneousness of the things that you can see that people are saying. But then it's also that very fact that makes you think, oh, should I then amplify this effectively? It's like writing something and then somebody goes around with a big, puts it on a billboard. It's that transition, I think, isn't it, from something that someone knows they've put out in public and they want the release of that, but then it's amplified to a bigger audience. And it very much kept coming back to the idea of, how do you use it, for what good ends are you using it, and about having people involved in it. So if you were going to do this as a research study, you would want people that had that condition to be involved in helping to kind of shape it and to draw the parameters perhaps of like what's appropriate to share quote wise and what's not. There was discussions about whether maybe if there's quotes you'd really want to use, you could try and contact the poster to say, hey, we've just done this, do you mind? But then that potentially feels invasive and you don't want to destroy their safe space that they're going to. So I think there's so many layers of complexity around sort of the best way to do it. And I guess that's really why we wanted this conversation to happen, and that the workshop and ongoing ones is around, I think this is going to happen anyway. And I think it's about, how do we make sure that we're all as involved as possible and the rare community is involved in kind of setting the parameters of how we think the best use of it is.
Because there's something really challenging, isn't there? We use social media kind of putting it out there, and we sort of don't expect a response. It's the sort of the anonymized aspect of it that is so helpful. I could imagine being quite mortified if someone said, oh, we've found this quote you've used and we've tracked you down, and could we talk to you about the fact you've posted, you were wondering whether it was worth staying in your marriage because your partner's so useless, or, sort of something like, oh God, I just felt that in that moment. I don't feel it all the time. So it's very exposing, and we don't want to inhibit that freedom to use it by saying, hey, we're now conducting a research, because people will use it differently again then too. Is that something you were thoughtful about as part of your research, Sian? How you make yourself apparent or not apparent? These are all public forums, so there's not privacy issues, but I guess it was in your mind.
Yeah, I mean, when I was putting quotes into my research, I tried to sort of see if I put it into Google, if it would come up straight away, and let's see if it would directly link back to that account or person, and how easy it was for that to happen, how easy it was to find, because I think it is a bit of a fine line of, like, this type of research, it is going to happen, and it could have some really good benefits because you're hearing from the direct source, but at the same time, it is sort of, I guess, an invasion of privacy. Although they are putting it out publicly, you don't expect, like, a bit like I think you were saying earlier, you don't expect to be seen.
I think as well with some of the rare conditions, I know that for when we were looking at it, some of the quotes were for conditions that are really, really rare. And actually, in those I mean, you have that in standard research, as well as having to be really careful that you're not going to identify someone purely just because it's so rare that it's quite easy to track back and work out. I think the other thing that's really interesting that came up in the workshop around particularly something like Reddit and the way that that platform works, is the engagement that different posts get and the way they get upvoted or commented on a lot. Does a kind of priority setting exercise in a way that you might not get in more sort of, I mean, I guess if you do more traditional surveys, you get a sort of statistic, but you don't get the interaction of the way that people are discussing it and upvoting it and talking about it and amplifying it. And that came up quite a lot in the workshop, that could be quite insightful, and that there's potentially really useful ways of using this in the early stages of research studies around kind of the feasibility or what the priorities should be. So even if you don't necessarily use it for the main bulk of the research because of all the issues we've talked about around privacy with quotes, for example, but you might use it to help you set the questions or the methodology for the rest of the research, or to use them together. So you might use the kind of themes from the social listening and take the quotes from the questionnaire, which are more traditionally consented.
I mean, I think it's helpful to note I'm always interested in what's the background of things, and social listening was initially came about through marketers wanting to look how brands and particular products were being talked about and used, weren't they, by their users. But I know since then it's also developed, the World Health Organization has been using it to see how people react during pandemics and how they might be able to use social media to kind of shape and inform behaviour to support people through difficult experiences. So it's not that it's unheard of in a health context too, but I think, it's just really through sort of your research and some of the thinking we've been doing, it's started to translate out into, okay, what are the potentials for our community?
And I think it's still I think it's probably quite, I don't know if mainstream is the word, but it's used quite a lot in sort of business, corporate, and, you said like maybe in sort of larger scale health context. But so in the workshop we did a question just at the start to say, have you heard of social listening, which we were getting people to complete as they came in. So it wasn't the whole group that responded, but I think there were 16 respondents. 10 hadn't heard of it. 4 said they had, and the other 2 had only heard of it because I'd had conversations with the clients at the workshop. One of the comments was great. It was like, I'm not sure, maybe I wasn't listening.
I mean, I'm aware of it from, we're particular generations, Lauren, but I'm thinking about, you've just done your undergraduate degree, Sian. Is it a methodology that is becoming more common as one of the research methods, or did you sort of bring it in particular in terms of your research?
So I sort of stumbled across it.
Okay.
Bit like
Originally it was going to do more of a traditional sort of get people in, have an interview with them, and sort of analyse the results from that. But there were some ethical issues with that due to the sensitive nature. And then it was sort of, I was directing, like, I would be directing a conversation in a way, so things that I might not have thought of might not then have come up. So with my supervisor, he suggested sort of doing more of an internet mediated style study, to sort of open it up a bit more to more people and get more different viewpoints. But yeah, but still sort of looking into that online nature.
I think it's like any new method, whatever it is, it often makes us all a bit nervous. We're sort of like a bit excited at one hand and we're a bit nervous on the other. So I think, hopefully if social listening's new to you, this has been a conversation that kind of opens up your thinking a bit and the potential for your own community, or just being aware it's on the radar, in the air at the moment. So I'm sure we'll be carrying on this conversation about social listening in many other sort of forums and events and opportunities going forward. But thank you so much, Sian, for sharing about your really fascinating and I think really important piece of research. And Lauren, it's always a pleasure. So
just say as well, we actually have a short video where Sian talks more about her research, which will pop up on our YouTube channel as well, so that if you want to go and find out a bit more about it, you can listen to that as well.
Great. Do check that out. And if you haven't found us before, please have a look at our other podcasts, and please do make contact with us if you've got any suggestions for topics you'd like us to cover. Thank you so much for listening.